state of emergency to deal with a measles outbreak.
This is a public health crisis, and it is time to sound the alarm and take the appropriate action.
Anyone under 18 years of age who has not received the MMR vaccine against the disease will be barred from entering public spaces for 30 days or until they receive the vaccination. 153 cases of the highly contagious virus have been reported in Rockland County since October, mostly in an Orthodox Jewish community. New York State currently allows religious exemptions for the measles vaccine.
I think something needs to be done, but just to say, we got to ban everybody underage and things like that, I don't see that doing more good than hurting.
If it's going to cause an epidemic, you have to follow the rules.
It's unclear how the temporary declaration will be enforced. Officials say violating it could mean a $500 fine and 6 months in jail.
There will not be law enforcement or deputy sheriffs asking for your vaccination record. That is ridiculous. However, if you are found to be in violation of this declaration, your case will be referred to the district attorney's office.
This year, the CDC has reported 314 measles cases in 15 states. Symptoms include a fever, cough, runny nose, rash, or even deafness or death. Health officials stress the vaccine is highly effective and offers 99% immunity against the disease. Tom Hanson, CBS News, Rockland County, New York. Health officials in Rockland County have declared a state of emergency.
So basically, there is this crazy outbreak of measles that is getting really out of control now. And so, and it has gotten out of control. And so we have a lot of people talking
State of
about
emergency
it
has been declared in Washington state as the number.
Yeah, I'm gonna see if I can go to it. It might not let me go to it, but yeah, it is gotten really out of control. And so I don't know, maybe you can hear what he's saying. I'll try to click on it. But this is pretty serious. This has to do with people's lives, and a lot of lives are at risk for you know contracting the measles or coming into contact with someone who is infected. And so some people may not have the proper health care. And so I think it's buffering. I don't know how it's going to work or not. We'll see. So this is a really scary thought that something we thought that was contained and once was avoidable, or we could say, it's been nipped in the bud. Now we're fighting this battle all over again. And, there are people in situations that are vulnerable. Either they have a lack of health care or they don't know who to turn to get vaccinated. They could be people who are homeless and they might be fleeing. We have the issue of people fleeing from other countries. And so they may be afraid to go to a facility to get medication because of fear that if they give their documentation or who they say they are, where they're living, that they're going to be deported. What do you do with people like that? And then, in the event that, let's say that this thing gets really far out of hand, what's going to happen to a lot of people? Some people may end up dying, or it may cause them to be really ill. And so this is pretty serious. And so I don't think people realize the severity of this type of thing, but I don't think this video will really play. But you can see here, there's a state of emergency over the outbreak of measles. And so that's where we're at now. We're in a place where illnesses are just like out of control now. And so, anyway, let me see if I can go to another window. Sorry about that. So it gets crazy when you have these things that are so easy. It looks like it can be, you can have exposure to something and that person not even be there. They left the germ there. And I heard that it can, even if a person sneezes and coughs, that area that they've, released those particles could be lingering there for up to 2 hours.
Some people think measles is just a rash, but the problem is it can be so much more than that. It can lead to really serious complications, things like brain swelling, meningitis, blindness, and liver problems, to name just a few. In some ways, vaccines may have become a victim of their own success because they're working so well, doing what they're supposed to do. Maybe people aren't seeing the serious complications of things like measles anymore, and maybe then thinking, this isn't a serious disease, why would I need a vaccine? But that couldn't be further from the truth. "20 years ago, some now completely discredited research published in the Lancet Medical Journal, which looked at just 12 children, sparked fears that the MMR vaccine may somehow be linked to childhood behavioural issues, autism. The vast, overwhelming majority of scientists and medics around the world say this is completely wrong, and there has now been loads of research to show there is no link.
So this is the longest measles outbreak in the United States since 2000, which is when the CDC declared it officially eradicated.
The problem is now that social media can spread this bit of misinformation more widely, more quickly, and public health experts are really worried that some parents may just be hearing these more skeptical voices and not hearing the important messages they're putting out that vaccines can save lives, have been given safely to millions of children worldwide. The World Health Organization says the measles vaccine alone saved more than 20 million lives in the last 2 decades.
Well, with that being said, what do you think people are going to do? Do you think they're going to actually listen, or are they going to believe their religious organizations and their skepticism and not get vaccinated and risk their own health and the lives of other people behind religious views or skepticism in whether these vaccines work or not? What's your take on it? Thanks for listening.